about hair loss, hair transplants. I'm really excited. We're going to be streaming on Instagram, TikTok, and so really excited about this. So if you're joining for the first time, this is weird because I'm on an iPad, and then like if I don't look at the screen correctly, it's weird for me. But let's see if this works. That works. Beautiful. Beautiful. All right, we're going to go live here. So if you're joining for the first time, welcome. My name is Dr. Ross Kopelman. I'm a hair transplant surgeon based out of New York City and Palm Beach, Florida. And I'm excited because I'm going to be talking here about hair loss and hair transplants. Hello, Aliza. Do not hesitate to ask me any questions that you want. I'm just getting the TikTok going. I'm really excited to talk to you about hair loss and hair transplants. So do not hesitate to reach out and ask me as many questions as you want as it pertains to hair loss and hair transplants, okay? So let's just make sure we have the live chat on. Perfect, okay? Okay, we'll be live on 2 platforms. So I'm gonna put this on airplane mode, and I think we're gonna be fine. If I need to switch the power source, I'll be able to do that. No worries, we'll go live. Okay. Okay, so let's do this. Let's go live. Going live. Okay, if you're joining for the first time, do not hesitate to reach out. I'm more than happy to answer your questions as it pertains to hair loss and hair transplants. Excited about this because we're going to be answering a lot of your questions tonight. Do not hesitate to ask any questions that you want. I love being able to answer questions about hair loss and hair transplants. I invite a lot of my friends and family members to join tonight. So yes, let's get this going. Let's have fun. So if you're joining for the first time, we're going to spend a lot of time talking about hair loss and hair transplants. And there's a lot of misinformation out there. Yes, you heard me correct. Misinformation. A lot of non-doctors talking about hair loss. So I'm going to spend a lot of time tonight trying to do my best to educate you about hair loss and hair transplants. And this is pre-Thanksgiving. So this is our pre-Thanksgiving party. And we're going to be talking about hair loss and hair transplants tonight. So do not hesitate to ask me as many questions. John, it's good to see you. You made your way over to TikTok finally. Welcome to the party. This is where we hang out and we talk about hair loss live here. And yes, if you have any questions about hair transplants, do not hesitate to ask me in the questions below. So if you're joining for the first time, welcome. My name is Dr. Ross Kopelman. I'm a hair transplant surgeon based out of New York City and Palm Beach, Florida. I go back and forth. I do virtual consultations for patients. I just got a great question from Finance, and Finance asked me, can you get hair loss, hair shedding from a crash diet? Absolutely. Any diet where you're losing a significant amount of weight, yes, this is going to cause an insult on the body, and this can cause a temporary hair shedding condition known as telogen effluvium. Temporary hair shedding condition. Now, this can last anywhere from 6 to 9 months. If you do nothing at all, meaning you're not proactive at all, your hair loss condition will resolve on its own. But if you want to be proactive, I would encourage you to think about using hair loss medications. At the top of my pyramid, it's going to be dutasteride. Dutasteride decreases DHT by about 90%. I also like minoxidil because minoxidil is going to thicken the hair follicle. And then, of course, I like a topical dutasteride from a company called Zion. There's a lot of things that we can do to start addressing your hair loss. And yes, hair loss is reversible. If you have baby little vellus hairs on your scalp, guess what? That's the time to start addressing your hair loss. Not tomorrow, today. I wish I had the knowledge that I have today 10 years ago because I would have retained a lot more hair. I actually have a little hair loss here. When I look at pictures of my scalp from even 5 years ago, my hairline has changed. Of course, finance. And thank you so much for joining our community. We're live here tonight on TikTok. So if you're proactive, you can reverse hair loss. Okay, and now I take hair loss medications. I have a full head of hair. This is not a hair transplant, but I have a little hair loss in my temporal areas, and so I encourage patients of all ages, whether you're female or male, if you're experiencing hair loss, this is the time to start asking questions. That's basically what the story is. I have a lot of female friends who are experiencing hair loss, and that's what happens. Lily, I'm still shedding, not as bad as the second month, but still shedding. It's freaking me out. Okay, so Lily, the first thing you have to understand is telogen effluvium is temporary. Okay, it can last 6 to 9 months. If we put you on hair loss medications like minoxidil, this can help slow the process. If we put you on a DHT blocker, this will help slow the process. There's other things you can consider doing as well. Red light therapy, PRP. Yes, of course, losing your hair when it's shedding is upsetting. It's very upsetting. And I see this all the time. I treat this every single day. I see hair shedding. So if you ever needed to do a consultation with me, you can always book a consultation. I'm more than happy to help you. And if you have other questions that I can answer tonight, do not hesitate. So if you're joining for the first time, welcome. My name is Dr. Ross Kopelman. I do not want you to be shy. You can ask me any questions that you want about hair loss or hair transplants. I am here to answer all of your questions. We have an amazing community here. I've never started anything, had a consultation, minoxidil, dutasteride injections. What do you think? So I like oral dutasteride. I like oral minoxidil. I like a topical from a company known as Zion. And I think that combination is really good. It sounds like you also are getting mesotherapy treatments, and I like mesotherapy. I do mesotherapy in my office. I actually like mesotherapy more than PRP because there's not as much variability in terms of the response. You get more consistent results, and yes. What is causing DHT in the scalp? Okay, well, DHT comes from testosterone. Testosterone converts to DHT, dihydrotestosterone. It's a hormone. Some of us are more sensitive to DHT. Everyone is sensitive at some level to DHT in terms of contributing to miniaturization of hair. But everyone's going to respond differently. So what do I encourage you to do? Think about being on a DHT blocker like dutasteride or finasteride, because this is going to block the 5-alpha reductase enzyme. And that way, guess what? You're going to get less miniaturization of hair. It's actually very important to not just be on minoxidil. It's important to think about DHT blockers, and it's okay for women and men. Okay, questions are coming in, and this is what I love. The more questions we get, the better, the more engaging this becomes. Okay, so let's go through some of these amazing questions. Hi, Hill. Hey, Doc, how should the hair serum be applied? So if you're going to use our hair growth serum, this is the Root & D hair growth serum that I developed. You want to apply this 30 to 60 minutes before a shower, and then you rinse it off. I don't want you to get a buildup of, I don't want you to get, some patients, if they keep it on overnight, it's not good. Everyone's scalp is different. So my recommendation globally is 30 to 60 minutes before a shower, and then rinse it off. You can use this a couple times a week, and it only requires a couple of drops, and then you rub it into your scalp and you leave it there. It has a refreshing smell, and it has natural DHT blockers in it: saw palmetto, rosemary oil, pumpkin seed oil, jojoba, and sunflower oil, and also peppermint oil, which helps improve blood circulation to the scalp. All of this is about preventing miniaturization of hair follicles. All of it is about improving blood circulation to the scalp for hair growth, for oxygen flow. This is a great thing to add into your regimen, even if you're taking pharmaceutical medications. But I know that there's a lot of people who just want to use natural ingredients, and you can pair this with our Root & D shampoo that has natural DHT blockers in it. So that combination is a nice combination, but I want to answer your questions about hair loss and hair transplant, so do not hesitate. So Dylan, just started finasteride at 28. Can I regrow hair back from a Norwood 3? Dylan, I don't know what your hair looks like, so I can only imagine what your hair looks like. I will tell you that I have patients who've been on hair loss medications in their 40s, not even at 28, and they had amazing reversal. A lot of the reversal has to do with how much little baby vellus hairs you have on your scalp. But I have 28-year-olds who have significant hair loss and they've lost hair follicles. So it's very patient specific in terms of that. So you think just then 2 is fine. I turned 20, started last year, 19 losing properly. Yeah, I think, think about using dutasteride and minoxidil. That's a great combination. Do you need a conditioner with your shampoo? You should always no matter what shampoo you're using, shampoos strip oils. Just remember that. This shampoo also has natural DHT blockers in it, so it helps prevent further hair loss, but always add back with a conditioner. We do have a conditioner coming out for Root MD in 2026. I am very excited about that. It's going to pair beautifully with our shampoo, but you got to be cautious. You got to be careful, not careful. You got to be patient. Patience is the word, because it is coming out. Thoughts on spironolactone for women? So Lily, here's the story. The story is that dermatologists are very poor at treating hair loss. Heed my words. Dermatologists are very poor at treating hair loss. Why can I say that? Not because I don't love dermatologists. My sister's a dermatologist. But what I know firsthand is that her colleagues, and she said this verbatim to me, are not that good at treating hair loss. They just don't understand it. They're afraid. They're afraid of using these medications. And so for women, they think, oh, it's just minoxidil. Oh, it's just spironolactone. By the way, I use spironolactone on men as well. Spironolactone prevents the binding of DHT to receptors. But, Lily, I put premenopausal and postmenopausal women on DHT blockers, dutasteride and finasteride. As well, the only thing you have to understand is that if you're premenopausal, you stop 3 months before planned pregnancy. Other than that, I would put you on dutasteride or finasteride over spironolactone, but I do use spironolactone as well when treating patients. There's a great question that came in about how can you tell if there's over harvesting done to the donor supply? One of the ways, and can you tell that immediately? Well, if you start to get like a lot of issues back here, where there's poor blood circulation, you feel like you don't see any follicular growth, then maybe there was overharvesting. Typically, we don't want to go beyond 5,000 grafts. 5,000 grafts are giga mega hair transplants, and I do those hair transplants. It's not for everyone. It's only if you have a great donor supply. So it's very patient specific in terms of being able to do that. And then the critical thing is, if you do go for a hair transplant, you have to be patient because hair growth takes time. Now, I do plan on having the first non-shave FUE clinic in the entire U.S., and that means I don't want to shave a patient ever again in the future. We are trending in that direction. That is the most advanced hair transplant techniques that we have out there. Can you transplant into an area where there was scarring alopecia? It depends. It's a very good question. It depends on the scarring alopecia that you have. If you have traction alopecia, absolutely. But if it's an underlying scarring alopecia due to an autoimmune condition like alopecia areata or lichen planopilaris or CCCA, you got to be a lot more cautious. Can't guarantee that. Why are hairlines often an inch higher than they used to be post hair transplant? Isn't that too high? I don't know what you're referring to. I mean, it's based upon the doctor that you go to. The goal of a hair transplant is for the hair transplant to look completely natural, as if you never had a hair transplant. That is the art of a hair transplant, and that's basically what the story is when it comes to hair transplants. Really amazing questions. I hope everyone's excited for Thanksgiving. Thanksgiving in the United States is 2 days away. I know we have an international crowd, so I just have to let people know that. But we're really excited. I mean, this is a beautiful time to spend with loved ones, your family members, and it's a great time of year. If we were getting results without minoxidil, does that mean the hair loss is reversible? Hair loss is reversible. Being on minoxidil is not a bad idea because it does thicken the hair. You can use it as a preventative measure. And when it comes to any hair loss medications, because I know that this was a question that just came out, it takes 4 months, minimum of 4 months to start to see results, and that's a critical thing for you to understand. Amazing questions. I'm so thankful. Doctor, if I stay on finasteride, will my hair stay the same level as it is now? So what medications do is they slow the rate. Nothing is going to completely prevent hair loss. But I have patients who've been on these medications for 30 years, and guess what? They've maintained results unbelievable. For 30 years, no side effects on these medications. It just plateaus the hair loss, okay? It reverses some of the hair loss, and then it plateaus it. How do you know if you have an autoimmune condition? Well, I have to see, Dylan. Do you have circular patches on your scalp? Do you have itchiness on your scalp? There's certain ways for us to identify whether you have a autoimmune condition. What conditioner do you recommend while waiting for your conditioner? You can use anything that has natural ingredients in it. There's a lot of great conditioners out there. I do think we're going to have a great hair growth conditioner because I don't think there's a great one out there, but I'm excited for that. I can't really give you advice specifically on one you should use at the moment. How to differentiate between telogen effluvium and pattern hair loss, and what's the difference in the treatment between the two? That's an unbelievable. I think that's the best question of the evening. Okay, so let's talk about this. If you're losing more than 100 hair follicles in a single day, guess what? You're in telogen effluvium, and if this is consistent, it's absolutely telogen effluvium. If you're progressively losing hair, you lose a few hair follicles, which you can't really tell. It's just kind of slow. You wake up one morning, you notice a little bald area over here, thinning in your hairline as a female or as a male. Then you're talking about androgenetic alopecia. Two different conditions. And by the way, you can have both at the same time. And the treatments are very, very similar in terms of how we address it. Do you have veneers? No, these are my real teeth. I've been brushing my teeth twice a day for my entire life. And of course, wearing retainers, and I had braces when I was younger, so that's a great question. But thank you. I know I have beautiful teeth. Okay. There's nothing wrong with a little vanity, right? Would you ever consider getting a hair transplant? Absolutely. Actually, in fact, I might in the future get a small hair transplant right over here to address this area. Someone asked me about PP405. Great. PP405 was viral, literally viral a couple weeks ago. Everyone was asking, oh, this is a miracle drug. It's going to solve hair loss. Well, guess what? I don't think it's going to solve hair loss. PP405 is a medication being developed out of UCLA through a pharmaceutical company called Pelage Pharmaceutical. And they developed a medication that helps to stimulate the stem cell activity at the bulge. We know that because there is a biomarker called Ki67. See all the interesting facts that are in my head. Why do I know that? Because I made a YouTube video about this, and I spent a lot of time learning about all different types of hair loss treatments. But anyway, PP405 is really exciting because we haven't had a new hair loss medication in over 30 years. Can you imagine? It's been 30 years since we've had a new hair loss medication. So I'm excited. However, it's currently in phase 2A clinical trials. We're a long way off. So you're just going to have to deal with the current regimen that we have. So yes, really good questions. Okay, what other great questions can I answer? I love to see you in person, but I'm in Ireland. Well, guess what, Dylan? I do virtual consultations, and 60% of my patients do virtual. I have patients in Dubai, Australia, the UK, you name it, I've treated it. So Ireland, you might be the first, though. I'll give you that. So you can always set up a consultation. Just go above to my page right over here, and there's a way to book. GLP-1 and hair loss. Liz, absolutely. I see this all the time. You lose weight and no one tells you you're going to possibly lose hair. Well, anytime you lose a significant amount of weight, guess what? It's going to have an impact on your hair loss. But luckily enough, Liz, I do treat this. I put women on dutasteride and minoxidil, and this has a very nice reversal in terms of addressing hair loss. It's almost been 3 months full, and I don't see any results in finasteride. Wait 1 more month, and then if you don't see results, also make sure that if you're not already on minoxidil, that's important. Also, if you're not getting any results with a DHT blocker, you should think about getting a genetics test, because the genetic test is going to help identify whether you're actually a good responder to finasteride or dutasteride. What are the side effects of finasteride? Well, every male, yes, I am on minoxidil. Every male is worried about libido, sex drive, of course, but that's 1 out of 100 men. But 1 out of 10 men have increased sex drive. Most men have no change. I don't believe in post-finasteride syndrome. I've never seen it. None of my colleagues have. So if it does appear, it's probably nothing to do with the medications. So don't be fearful, but I know that you might be fearful. You can get inner groin pain, testicular pain. If you have underlying anxiety or depression, that can be increased. Females, you don't have to worry about any of this except maybe the anxiety and increased depression. But again, these are not common side effects. These are very rare side effects. They're not common. And I microdose these drugs, and when you microdose drugs, guess what? These side effects all disappear by the wayside. So that's basically a good insight for you to all know. What is my favorite fragrance to wear? I don't wear cologne. I think I have a great natural smell. So these are really good questions. Can finasteride actually help post-transplant or not really in terms of strengthening hair? Absolutely. You must think about hair loss medications like fertilizer for the hair. This goes without saying. Please do not ignore the fact that hair loss medications are critically important for you to get long-term great results. It's a hair transplant and medical therapy that are going to give you the best, absolute best results. I want to thank everyone who's joining for the first time, or if you've been here before, we love having you back. This is the fastest growing hair growth community in the world. Heed my advice. The fastest growing hair growth community in the world. And this was started about 12 weeks ago. We're uh, on the way to 16,000 members. And we cannot believe the growth that we've had. We've answered thousands of questions, and we love having you part of this. This community is very much like an oncology support network, and we've helped women and men address their hair loss, whether it's from shedding or an androgenetic alopecia or from an autoimmune condition, or if you're thinking about a hair transplant, they come here and they get advice from me. No one in the world has spent more time going live on TikTok as a hair surgeon educating patients. Okay. A big part of what I do is education, because if you're educated about your hair, guess what? You're going to make the right decisions. You can ask your hair doctors the right questions. You're going to not just go with the flow, but you're going to go in very informed. And that's why we love the Root MD community. Okay. And we just so happen, so 90% of the time I educate patients, 10% of the time I joke around and make some jokes, and 2% of the time I'll talk about our Root MD solutions that we've developed. I don't care if you buy these. What I care about is that you're educated. We do believe we are developing the best natural hair growth solutions in the world. I believe RootMD is going to be a very successful solution. It's going to be a very big brand that's synonymous with helping with hair growth. And we want to be part of your journey. We want to be part of that journey. And the beauty is that, let's say you need my help, right? As someone who's a hair loss expert, you can book a consultation with me, right? And I'm going to give you a tremendous amount of advice, because what I'm going to tell you is there's a lot of people on TikTok selling just the serum or just the shampoo, but I don't talk only about that. I talk about hair loss medications, and I'll never lie to you. Hair loss medications are at the top of my pyramid. Okay, I like dutasteride, I like minoxidil, I like finasteride, I like spironolactone, I like topical dutasteride from Zion. These are medications that are critically important for addressing hair loss. Someone just asked me about seborrheic dermatitis. I have seborrheic dermatitis. So I get itchiness in my scalp. When that happens, I usually use clobetasol foam, which is a steroid to help lower inflammation, and then it calms it down. That is the big way to address this. Sometimes you have to use a prescription shampoo called ketoconazole shampoo, but the big thing now is using a steroid, or there's a drug called Zeruv that helps to address dandruff. And dandruff is very common for a lot of patients. So these are great questions. I want to thank everyone for joining. What do I think about latanoprost? Latanoprost is great. It helps with eyelash growth, eyebrow growth. The one thing that you have to understand, it sometimes can darken the iris, but it is a great solution for that. What would you recommend for traction alopecia and androgenetic alopecia? Well, traction alopecia, you have to understand, is a condition caused by wearing really tight braids. And you have to loosen those braids. And so that's basically how you treat it, but it's irreversible hair loss. Someone asked me, can minoxidil cause headaches? Absolutely. We know this. I have patients that sometimes get headaches. Sometimes patients are really sensitive to minoxidil. So we try to microdose the drugs, and if that doesn't work, we have to take you off of it. There's no way around it. Some patients don't have any side effects from anything. So you got to recognize it's not one size fits all. Everything is customized. Everything I do in terms of treating patients is customized. Now, if you're joining for the first time, I want to let you know I practice in New York City and Palm Beach, Florida. I go back and forth from these two offices, and I spend a lot of time also doing virtual consultations. So do not hesitate to ask me anything that you want. Okay, what other great questions can I answer for all of you? Please leave all of your questions below, and more than happy to answer them. Where's everyone calling from? Anyone from New York City? Anyone from Florida? Let me know in the comments below. I'd be very curious where everyone's joining from. And as you can see, if you want to check out the RootMD hair serum, you can. Houston, Louisiana, Chicago. I love it. I love it. Everyone always has to fly through Chicago. Like, it's the biggest airport. Crazy. We have Fort Lauderdale. I'm flying to Fort Lauderdale tomorrow. So if you're in Florida, you can come to my office. We got Los Angeles. That's our good friend Maris, who goes live. New Jersey. I'm actually in New Jersey right now. I have another office in Paramus. I don't talk about my Paramus office that often, but I do. My main offices are in New York City and Palm Beach. And Serbia. Wow, Serbia. That's the first. We have Houston, Texas. Moldova. We have a Moldovan. Amazing. We have a very international crowd tonight. I'm very fortunate to be here, spending time. We have someone from India. Oh my gosh, someone from India. You can use minoxidil on your scalp even if you have seborrheic dermatitis. Georgia. Okay, great crowd. Okay, so let's get back to what matters here. The number one cause for hair loss is going to be genetics. Okay, genetics. Come to Ireland. I'm coming. I'm getting in a plane right now. Genetics. So hair loss is polygenetic. It's your mother's side, it's your father's side, but we can't run from our genetics, right? But if you have a genetic propensity for hair loss, you're going to be more sensitive to a hormone known as DHT, dihydrotestosterone, and this is going to contribute to hair loss, so you have to think about using a DHT blocker, and that is going to either be dutasteride or finasteride. These are both great medications. I also like a topical dutasteride from a company called Zion. Spironolactone helps prevent the binding of DHT to receptors. Minoxidil, by the way, everyone talks about minoxidil, Rogaine, topical, oral. This doesn't prevent hair loss. This thickens your hair, thickens and improves blood circulation to the scalp. Now, let's say you don't want to use any pharmaceutical medications. Well, there's red light therapy. There's PRP, platelet-rich plasma. There's a lot of different other things. There's saw palmetto, rosemary oil, pumpkin seed oil. By the way, these are all in our serum and in our shampoo, so you can always check that out. Okay, what other great questions do you have about hair loss and hair transplants? I love this. If anyone wants to join live, I'm happy to have you join live, and I can answer questions. I have terrible anxiety on the fence about finasteride. Want to get my blood work done. Try 1 pill a week. Try 1 pill a week. I have a feeling you're going to have no issues. That's what I do with some of my patients, by the way. Do you have to get a hair transplant to regrow what you lost? Unfortunately, yes. If you lost hair follicles, it doesn't matter what magic potion you rub on that scalp. It ain't going to grow back. That's the critical thing for you to understand. Okay, what are the great questions can I answer for all of you? Thank you so much for everyone who's joined today, who's spent time asking questions. I really do appreciate it. I love this community. I could not have done this without you. I'm curious, what is everyone doing for Thanksgiving? Thanksgiving is around the corner. Are you going to be with family and friends? This is the time to rejoice and be together as a group, and you should be with the ones that you love. That's what matters. What are the great questions can I answer for all of you? Thank you so much for everyone who's joined today. I'm excited. We try to go live every day. When I use your shampoo, I definitely love to massage it in for 5 minutes in the shower. Well, we love that you're enjoying it. That's what we love, and we hope that it's going to help with reversing some of your hair loss. I'm a medical student studying, and now I'm having some hair shedding. This is not a surprise. Medical school is hear my word, very stressful, and so this can cause telogen and effluvium. Not surprised at all. And if you want to be proactive, then I would think about being on minoxidil or dutasteride or a combination of both. So what other questions can I answer for you? So this, just use your hair serum tonight for the 4th time. No irritation at all. Perfect. I'm happy to hear, David, that's going well. I'm using PRP, so what do? I'm 26 years old. When you go for PRP injections, it's like any Botox. You got to be consistent. It's consistent treatments that are going to help address your hair loss. It's not one particular thing. It takes a lot of work to maintain that consistency when it comes to your hair loss. So just keep it up. You're doing well, and stay proactive. All right, what other great questions can I answer? In your experience, can using dutasteride at 0.5 milligrams? Why? Yes, that's the dosage I usually do. Why beard hair trans looks generally bad? It's hard to do a beard hair transplant. You need a lot of hair to make this work effectively. And that's really the critical thing for you to understand. It takes a lot of hard work to make this effective. 3 times a week be as good as using it every day. Yeah, you can microdose these medications. There's no issues with microdosing medications. Should I use minoxidil 5% and finasteride 0.3%? I like oral minoxidil better and oral finasteride. I also like topical dutasteride better because it's a larger molecule. It will stay localized on your scalp for prolonged periods of time. Lots of stuff to treat DHT blockers. That's true. Or hair thickening. What about growing actual hair? Well, growing hair, well, minoxidil is going to help to prolong the growth of that hair, and the DHT blockers are going to allow that hair to regrow too. So it's preventing hair loss, but it's also stimulating new hair growth. What what's something that surprises most people when it comes to hair transplants? That's a good question. I think patience is the biggest challenge. Telling patients it's going to take 6 to 9 months for regrowth. No one wants to wait. Everyone is has a low threshold for waiting. So does topical dutasteride go less systemic? Yes, it does. It decreases by 95%, and it stays localized on the scalp for prolonged periods of time. Very good question. PRF injections, Chris, there's no additional benefit over PRP. Red light therapy, I do like red light therapy for some patients, though it requires consistency, and these helmets can be very expensive. So think about it. That's all I'm going to say. Really think about it. Really good questions. I want to thank everyone who's joined. You've asked me amazing questions tonight. What do you think about transplanting into a scar? I have a small scar on the back of my beard. You can transplant into a scar, and sometimes when you transplant into a scar, the graft will help to remodel the scar tissue. So something to think about. Do people not want to wait because we live in a society that likes instant results? You got it, Dustin. Everyone is like, they get their transplant yesterday and they're already worried that it's not growing or they didn't get enough grafts. You got to be patient. Yes, you might have to go for a second hair transplant. You might have to go for a third. But you have to be, you got to be patient because it takes time. It takes time for this stuff to regrow. Can you say Ozempic causes hair loss? Yeah, absolutely. I see Ozempic hair loss all the time. This is a very, very common thing for me to see in my office because patients, Yanette, are losing a significant amount of weight. And guess what? When you lose a significant amount of weight, it's going to cause hair loss. It's going to cause hair loss. So yeah, really good questions. More than happy to answer all of your questions as it pertains to hair loss or hair transplants. Do not hesitate to ask away. I love this. Like the person who didn't see results from shampoo after 7 consecutive uses. Yes, absolutely. What other great questions can I answer for all of you? What's the most amount of grafts you would do at one time, and what are the limitations? Brian, it's really based upon whether you have a great donor supply. This past week we did hair transplants with anywhere from 35 to 4,000 grafts. These are big hair transplants. So it's really based upon whether you have a great donor supply. If you don't have a great donor supply, it's not, we call hakol beseder. It's not all good. So that's basically the idea. Okay, what other great questions can I answer for you? More than happy to answer any questions as it pertains to hair loss, hair transplants. I love this, and I love answering your questions because this is what matters. What matters is being able to show up, answer questions about hair loss and hair transplants. No one else is doing this. I'm the most active hair transplant surgeon in the world going live, talking about hair loss and hair transplants. And yeah, if you lose 40 pounds in a year, could that cause hair loss? Yes, telogen effluvium, without a doubt. I'm trying to get to everyone's questions. These are good. What's the outcome of using BE Body-Wise hair growth roll-ons? Is it safe to use one? Okay, so this little device that has some natural things in it. You roll it on your scalp. 2 minutes in the morning, 2 minutes in the evening. That's 4 minutes. First of all, that's a lot of time. 2, these devices are not that clean. I think it's more of a gimmick than anything. I think patients are buying it and they're going to do it. But to be consistent is hard. My goal is to simplify your routine. Do you understand? Simplify your routine and maximize your results. That's what I'm all about. So I don't think it's the best device. Dutasteride is sometimes covered by insurance, but if it's not, it's dirt cheap out of pocket. Should I microneedle with minoxidil? I'm not a huge fan of patients microneedling at home because I'm worried that if you don't clean the device, you can reintroduce bacteria. So you got to be very, very, very careful. Yeah. For women with shoulder length thinning hair, is it better to cut short for better, faster growth? Otherwise, wear a wig when you no. You got to, Deborah. Let's put you on minoxidil, oral minoxidil, and you're going to thicken your hair. Cutting your hair doesn't make a difference. By the way, if you're joining for the first time, my name is Dr. Ross Kopelman. I'm a hair transplant surgeon based out of New York City. Yes, the Big Apple, the best place in the world. And copper peptides, yes, are good for stem cell activity, stimulating stem cell activity. I love what I do. I absolutely love what I do. I'm fortunate to be able to help a lot of patients with hair loss and hair transplants, and I love this. Did minoxidil grow hair in other places that I didn't use it? Yeah, it can. It can grow hair anywhere, and that's the conundrum that a lot of patients have. They're worried about being on these hair loss medications long term, and that can be frustrating. Okay. What are the great questions? So yeah, I just wanted to say that, yes, if you needed a consultation, you can always book one virtually. I see 60% of my patients virtually, both men and women across the country and international. So that's basically the story about me. All right, what other great questions can I answer for all of you? Do not hesitate to ask me anything that you want. In between an hour, 2 or 3, and dealing with hair loss, you got to be proactive. Go on hair loss medications. That's what I would do. Might be going to New York City next year or two. Does it cost money to see you? Yes. My consultation fees are $350, but you're covered for an entire year of care. That's comprehensive care. Comprehensive care. That means you can see me as many times as you want. You can do as many virtual appointments. You can come in as many times as you want. I don't know where you can get a better deal than that. I treat every single patient as a family member, and that's basically my philosophy. Where do you purchase your medical supplies from? All over the place. I mean, we have all different supplies from all over the place. Okay. How to prevent hair loss? That's a big loaded question. I think we're addressing that one tonight. Okay, what other great questions can I answer? So, in case you haven't checked out the Root MD shampoo, you're going to want to. Number one, this smells great. It's a beautiful shampoo. We have amazing reviews. The only one review that we got where we got 3 stars was because they said it didn't work after a week. Well, of course, if you do anything with your hair loss, 4 months, nothing grows in a week. So that was a funny review to read. But our reviews are very positive about this. Yeah. Gummies. The gummies have to be packed with the right concentration of hair loss meds. I actually know the founder of that gummy. And I have nothing bad to say, but you got to always make sure it's packed with the right ingredients. Yes. Okay, what are the great questions? What's the shedding timeline with Zion topical dutasteride? So typically what I see is shedding happens if you are experiencing shedding to start. So if you're going through tillage and effluvium, that's when you really experience this excessive shedding. Whereas if you are having slow androgenetic alopecia, when I started hair loss medications, I had no shedding. So shedding is not something I typically see unless my patients are experiencing tillage and effluvium. How much would it cost for a receding hairline? I don't really understand what that question is. Like for a hair transplant, can you use the serum on the scalp after a hair wash? You can, but typically what I like, Paris, is that you apply this before 30 to 60 minutes. You don't leave this on too long. Rosemary, pumpkin seed, salt palmetto, if it's left on too long, it can be too irritating to the scalp. So I like to be more cautious, and I do recommend going slow. So that's what my recommendation is with our hair serum. Our hair transplants range anywhere from $20,000 to $35,000. We're on the higher end, so when we perform a hair transplant, there are 2 hair surgeons that work on you. There's 3 technicians and a nurse. It's a team of 5 or 6 people. It's a lot of people. It's a 10-hour surgery. It's a long day. So these are very, very big cases. Hey, I went through a hair transplant about 14 days ago and developed some pus, yellow fluid after now the pus is settling, but it sounds like you need to be on doxycycline hyclate. You develop some folliculitis, and that's what I would do. I would either go back to your hair surgeon or you can come back to me. Yeah, Dylan, it's different. If you go to anyone in the United States under $10,000, I can guarantee you they are not the most qualified hair surgeon. You need to, recognize that quality is going to cost more. That's basically what the reality is. And that's because those doctors are going to be in more high demand. They take their training more seriously, and that's basically what the story is. These are also very big cases, and they require a lot of staff. So it would be basically impossible for me to do a hair transplant for $8,000. Okay, what other great questions can I answer for all of you about hair loss, hair transplants. More than happy to answer any of your questions. I feel very fortunate because I am part of this community as much as you are, and this community is only on the up and up. I hope everyone's gonna have a beautiful Thanksgiving. I'm excited for spending more time with family and friends because, of course, there's never enough, as they say. There's never enough. Okay, I love doing this, and I'll keep answering your questions. We love going live because we love building this amazing community. We get amazing insight from you because of all the questions that come in here. I have alopecia. I use minoxidil foam and stop using hair. Okay, so I like oral medications the most. Oral medications are going to be the most effective to address hair loss. That's just like hands down what the reality is. I like oral dutasteride, oral finasteride, oral minoxidil. These are all great medications. Oral minoxidil, by the way, will thicken your hair follicles. If your follicle looks like that, it's going to thicken that. And thank you. We love having you part of this channel as well. So thank you so much. Very appreciative. We've built an amazing community, and I could not have done it without you. This is the truth. It's the community that matters. It's the people that I get to spend time with. Do you deal with patients who got hair transplants by another surgeon? Yeah, I do. I see complications all the time. In fact, I see complications from well-established hair surgeons who've had complications. So everyone really does develop complications. When you're doing surgery, there's a lot of variability that can happen, and there's certain things that you can't control for. What we can control for is providing and doing our best to provide the highest level of care for our patients. And that's what matters. That's what matters. Just recognize that's what matters. You want to go to someone that's committed to being there if there's a complication and knows what to do if there's a complication, because complications do arrive. Can I get a tretinoin at a walk-in clinic? I think you can. I'm pretty sure you can. Or you can get it on a telehealth site as well. There's a lot of different places that you can get tretinoin. I'm currently using 2.5 milligrams of oral minoxidil, 22 years old, no side effects till now. Is it safe for long-term use? Yes, absolutely. These are very safe medications. Our conditioner will drop in probably late January, February. We're going to have we will have a pre-order for our conditioner that's going to come out very soon. So look out for that. We will announce that. But yes. Could hard well water cause hair shedding? I'm not really that concerned about that. There's a lot of people who are worried about like the type of water that they're using, but I'm not. If I started finasteride a week ago, would you advise to jump to dutasteride? No, Dylan, stay on finasteride. It's the most common prescribed hair loss medication in the world. There's no reason why you can't continue on that medication. These are amazing questions, and I am so proud to be part of this and be able to answer your questions live here. I don't know where you can get more free information from a hair doctor than here live on TikTok. How do you stay that energized without any stimulants, coffee? Yeah, I don't know. I just keep going, and there's more to do. My evening never ends. I still have to finish packing before I leave for Florida. I'm excited because it's cold in New York, and I need some warm weather. So where's everyone going to be for the holidays? Let me know in the comments below. Are you going to be with family? If you're going to be with family, let me know. I'd be very curious to know if you're going to be with family and friends. Because it's important to be with family and friends during this holiday season. Florida, amazing. I'm going to be in Florida too. San Francisco, beautiful. And I'm assuming you're going to be with family, of course. What is best for females, finasteride or dutasteride? Either. I mean, I put most female patients on dutasteride, but sometimes I put females on finasteride as well. Puerto Rico, someone's going to be amazing. Get more information from me, Dr. Kopelman, compared to waiting a year for my dermatologist. Well, that's why you're here, and I hope you get to join our community, Dylan, and you come back. It looks like Maris is going to be in Portland, Oregon. He's going to be live in Portland, Oregon. Should you date your coworkers? If you like them and you treat them well, why not? I don't see anything wrong with that. You might even fall in love. You might have kids. How can I regrow your hair, Wayne? You got to go on hair loss medications. Finasteride, dutasteride, minoxidil. These are very important medications to think about being on. My blood work is all normal. My hair is falling out like crazy. What could I do to stop it? Adriana, I would have to see you in a consultation to really give you a proper assessment. So I don't know exactly what's going on with you. I don't know if you're having telogen effluvium. I don't know if it's androgenetic alopecia. I don't know until I see you. But I will tell you that being on hair loss medications and being proactive on these medications is critically important. Oh, looks like we got a violation. What did I do now?
That was fake. That was a fake person. They were trying to get you to shut the live off.
Oh, that's funny as hell. Okay.